plans have been set to help with the expected surge of Omicron, but there are still a lot of unknowns about the variant that has already become the dominant strain in the U.S. WRTV's Nikki DeMentri is getting answers from an expert who has been keeping a close eye on COVID numbers in Indiana throughout the pandemic.
Experts tell me there's still a lot to learn about the Omicron variant and note the consequences may be crushing to the state's healthcare system. We spoke with Dr. Brian Dixon with the Regent Street Institute, a research organization tracking COVID-19, to learn what this all means for Hoosiers. Talk to me about Omicron. What are we seeing Omicron-wise here in central Indiana and in Indiana in general?
Yeah, what we're seeing so far with Omicron is that it's quickly becoming the dominant strain of the disease in new cases. So it sort of went from at the beginning of the month, like 1% of cases or less than 1% of cases, now all the way up to, we think, about half of new cases or higher are due to the Omicron variant.
We have at least one Omicron case confirmed here in the state of Indiana. How many more can we assume we have since that positive test came from earlier this month?
Yeah, so since that case was several weeks ago, I would expect we probably now have several hundred cases of Omicron in the state, and they're probably in multiple parts of the state, although many of them are going to be in our urban areas.
Does Omicron spread more easily? Do we know that right now?
Yes, we know that Omicron spreads twice as much as previous variants, including the Delta variant. So it spreads much more rapidly, not only in Indiana, but in all the other places that we've seen Omicron pop up.
Sure, absolutely. Talk to me. Does Omicron cause more severe illness than we've seen with other variants? Do we know that at this point?
We don't know that conclusively at this point. There's some early evidence that would suggest that, but it's generally in countries with younger populations, so it's too early to tell whether it's more or less severe than other variants.
Dixon expects the number of Omicron cases to dramatically rise in the next several weeks across Indiana. Right now, there are about 3,000 Hoosiers in Indiana hospitals. Dixon says projections increase that number to 4,000 to 5,000 by early January. It's something he says the state has never seen. Working for you, Nikki DeMentri, WRTV.
Well, Dr. Dixon says it's important for health officials to keep a close eye on the number of COVID cases and hospitalizations to navigate Indiana through this surge. The newest numbers from the State Department of Health show 3,800 new positive cases and 118 new deaths from COVID-19. About 3,000 people were hospitalized with COVID as of yesterday.